Good afternoon, everyone. The presentation for today is on outcomes from the Center for Early Childhood Caries research. The presentation is outlined into four major headings: outcomes of risk factor studies, outcomes of fee studies, outcomes from OXIS, and sustained anticipatory guidance studies. So I'm going to give you a brief overview of what happened from CECCRe so far. One of the most important lessons we have learned from the risk factor studies is from this systematic review. Most of you would have seen this paper, a brilliant piece of work by Dr. Kritika and Dr. Ankita. And this is one of the most cited paper in ECC research currently. The biggest lesson we learned from the systematic review is, among the numerous risk factors associated with early childhood caries, the primary risk factor, or the number one risk factor, which has a very high association, is enamel defects or enamel hyperplasia. So as a clinician, the moment you understand this, it's important that you like to apply this information in practice, in your teaching in the departments, etc. This establishment of enamel hyperplasia and enamel defects as a number one risk factor is reiterated by another umbrella review in 2021. So this is one of the highest level of evidence available at this point of time in this topic. That indicates that if you could identify enamel hyperplasia, enamel defects, as soon as the tooth erupts into the mouth, there is a great possibility that you can remineralize these lesions. You can prevent infants from getting into a full-fledged early childhood caries. So this can be identified, and in fact, you can see remineralization with your naked eyes. I'll show you an example. This is one of the patients from my practice with newly erupted primary incisors with enamel defects in almost all the four incisors, and effectively followed up, managed, intervened, and arrested this disease process completely and followed up for almost close to 3 years. The child is still under review with us. So this is one example of the lesson learned from the systematic review and the knowledge gained from that and putting that into practice. Another major outcome from fee studies. At the outset, the need for fee studies emerged from the lacunae in existing ECC research outcomes. There is always a contradictory association between nocturnal feeding practices and early childhood caries. There are papers supporting and talking against it. So we wanted to understand the role of sleep time feeding practices in depth. So a newly developed tool in the name of fee scale was developed. A brilliant piece of work by Dr. Akila, public health dentist, head of the department here, and a series of studies has happened. And the outcomes from these fee studies has clearly established that sleep time feeding practices are constantly associated with occurrence of early childhood caries with a very, very high ratio of odds. And Dr. Akila will talk in length about this in her presentation, and more research from using the fee scale coming from other countries will validate this result in the coming days. The moment we know that sleep time feeding practices are very highly, strongly associated, continuously associated with occurrence of early childhood caries, it's important to discourage that, at least on high-risk children, at least the children who present with enamel defects or enamel hyperplasia. They need to be identified, categorized as high risk, and we have to help them to come out of the sleep time feeding practices and also simultaneously improve oral hygiene measures on these patients to protect these highly vulnerable, more porous, permeable surfaces on their enamel. So the suggestion is only to identify high-risk individuals, high-risk children, who are more susceptible and vulnerable for this disease, and emphasize this, discouraging sleep time feeding practices, and also suggest methods to overcome sleep time feeding practices. But you can continue your feeding in the daytime when the child is awake, when the infant. There are more research needed in this area. Methods to overcome sleep time feeding practices needs to be studied in length. OXIS studies, Dr. Kritika, is associated from the beginning. The first classification came with her preliminary work using CBCT, and we have done a series of studies, and this is also studied in different population at this point of time, and we have categorically disproved the knowledge related to primary teeth contacts, which is routinely taught as the contacts between primary molars are broad and flat and located further gingivally. This information in the textbook is not right, and we have established this clearly with longitudinal prospective and retrospective studies that there are variations in interproximal contacts between primary molars, in fact, in the anterior teeth as well. And the certain surfaces are highly vulnerable and more prone for proximal caries, predominantly the I type of contacts and S type of contacts. These contacts make them more complex to clean, more vulnerable, and more susceptible for prolonged accumulation of food particles and inaccessible for interproximal cleaning. The moment we realize this, it's important as a clinician to identify these complex contacts on the posterior teeth as early as possible during routine examination, and encourage the parents to keep this area clean by establishing good nighttime oral hygiene practices for these children. And predominantly the I and S type contacts need to be monitored closely and put them on rigorous childhood or oral care measures with appropriate night brushing and additional oral hygiene measures as needed. Even as a clinician, if there is a possibility while placing a stainless steel crown, if it establishes an eye contact or a S contact with adjacent tooth, by a slight rotation, if we can create a contact which is X type of contact, which might be more favorable for interproximal cleaning, the possibility for such things need to be considered. More research, more knowledge will emerge in the coming years, but as a clinician, you can see this logically. It will make the adjacent intact tooth surface more vulnerable just because we are establishing a complex contact there. The sustained anticipatory guidance studies. Anticipatory guidance is a very well-established philosophy in pediatric dentistry, and developmental-based counseling, age-appropriate counseling. And this is, if this can be sustained using the protocols which we have established, and we have named it as sustained anticipatory guidance. Our first work started in 2016, and we have published this, a small cohort of cleft children in caries research. And now we have fine-tuned these protocols. We are very, very clear in putting a system in place, integrating technology, and establishing robust system using the sustained anticipatory guidance principles can play a major role in preventing early childhood caries at a community level, at a village or a town, or even a larger level in the state and the country. These protocols need to be established and monitored and sustained for the first 3 years of the child's life. And one of the things which has been recently becoming very, very useful is the MAC charts. Dr. Ankita will explain in detail in her presentation, a brilliant piece of work, which is proving to be a fantastic tool to self-report earliest changes of early childhood caries by the parent or caretaker. We got some very good results disseminating this in the cohort which we have right now. And with the experience behind, we can confidently say that at $2 per month per child, you can technically bring every child cavity-free up to the first 3 years of age. It seems very much possible for us. We have learned this in the last 4 or 5 years the systems, where things can go wrong, where support needs to be stronger to the parent and caretaker, and how to identify the earliest changes and bringing them on board for appropriate preventive measures and reinforcement of oral hygiene measures, provision of the oral hygiene aids, overall sustaining the guidance in the first 2 to 3 years can play a major role in preventing early childhood caries in the coming years. And we believe that this protocol will emerge as one of the cost-effective, economical way to prevent early childhood caries at a larger scale in the coming years. To conclude, research outcomes must enhance people's lives. That's translational research. In fact, it should bring meaningful changes in the society and community. If planned and disseminated well, research outcomes can reach the community to the common man in a span of 2 to 3 years from the time meaningful outcomes emerge from high quality scientific studies. At CECCRe, we are trying our best to make an impact in the society by answering some crucial unanswered questions pertaining to early childhood caries. Outcomes from risk factor studies, OXIS studies, fee studies, and SAC studies from other parts of the world will definitely change this disease burden of ECC for the rest of the world in the next 2 decades. Thank you very much for your attention, and I'll be happy to answer some questions now. Thank you very much.